Hi, it's the Choppiness guy. Welcome to today's episode of Vestibular Talks. Today's episode is called My Viral Side Overcoming Lyme Disease and Chronic Illness. Today's episode introduces Lindsay. She is a former Lyme or a former Lyme disease sufferer that has overcome her condition by retraining her brain. Now she's coaching people and offering virtual programs that teach people how to find relief from chronic symptoms, stress, anxiety, and fear. Remember to like, share, and subscribe. Enjoy the episode, guys, and find your chaplains. Hi, Lindsay, we're live.
Hi,
How are you today?
I'm doing well. Thank you for having me.
No, it's a pleasure. Thank you for taking the time to join us in Vestibular Talks and to share your journey with us. So we really appreciate it.
Yeah, I'm excited to be here.
Awesome. Do you mind telling us a little bit about you?
Yes, sure. So my name is Lindsay. I am the founder of VitalSide. It's a brain retraining program. So basically what I do is work with people who have chronic illnesses, who are in this kind of stuck 24/7 fight or flight mode. I think a lot of us can kind of relate to that, whether it's through chronic symptoms of anxiety, fatigue, even symptoms like dizziness, stress, pain, and I help people to get out of that fight or flight response. And how I kind of came into that was my own journey with chronic illness, being diagnosed with Lyme disease, going through the process of trying so many different treatments and figuring out what worked for me, what didn't. I think so many of us go through that process. And I had gotten to this place where those physical treatments weren't helping anymore. And I had detoxed and I had treated and I had done all of the things, but I was still sick. I was still symptomatic. And that's when I started learning about the brain, researching the brain. My background's medicine. I'm a trained physician assistant. So I thought, okay, this makes sense, how the brain changes, this concept of neuroplasticity. And I learned how that correlated to chronic symptoms, chronic illness, and the brain's role in chronic illness, and how so often we treat the body, which can be extremely beneficial, but there's a time and a place where we also have to look to the brain, which is the control center for the body. So that was familiar to me, and I learned about that process. I started to use some, neuroplasticity tools or mental exercises. And, in about 8 months' time, or a little bit less than a year, I recovered from Lyme disease. And that was about 5 years ago. So I haven't had symptoms since. And now I work with people who do. And it's my joy and it's my passion.
Awesome. Thank you for sharing that with us. And from watching the video that you shared with me prior to the interview, I noticed that prior to getting your diagnosis of Lyme disease, you were struggling with a lot of symptoms that they weren't chronic at the point. They were kind of like episodic, but they were still bothering you and making you wonder what is happening to me. So do you mind telling us a little about what those symptoms were and how they came about?
Sure. So with a chronic illness, you can always go back to so many different times in your life that you experienced the symptoms and you're like, wait, what was that? I can trace back to when I was 15 and diagnosed with Epstein-Barr and was out of school for 3 months. And then prior to that, going back to even childhood trauma and living through that and the symptoms that I had from that experience. And so it's like we've got these situations that have happened throughout our lives. And I think we do a good job at connecting the dots. But going back to all the way back to when I was 8 years old and experienced childhood trauma, I think that was the point where my limbic system, my limbic brain, or my fight or flight autonomic nervous system response, that survival response kicked in. And as a result, it was good at the time because it got me out of danger. But as a result, that became my go-to response, because at the time I was like, okay, I need to get out of danger. I need to flee. I need to run away. I need to get out of here. I need to stay and hide. And that response became my sort of low-level primary nervous system response. So typically we have the fight or flight response, we have the freeze response, and then we have that growth and repair response, or rest and digest.
Yes.
And typically that's the kind of go-to response, ideal response when we're living our lives and operating and functioning as a child. And fight or flight was my go-to. So I think that was kind of the first time that I experienced that. And then that became my go-to response, diagnosed with Epstein-Barr. And then there was this period of, 15 years old to mid-20s where I had, random gut issues. And I did a lot of traveling. I was a travel PA. So I was in Bolivia for 4 months and contracted parasites. And so I had a lot of those gut issues. And then I would kind of get sick a lot. I was not, my immune system was not very strong. So anytime I would come in contact with someone with an acute infection, I would immediately get it. Mm-hmm. And that wasn't great because I was, a physician assistant. So I was always coming in contact with acute illnesses. And then I was bitten by a tick, and that became my perfect storm of my body could not handle this anymore. My nervous system could not handle this anymore. Yeah. Something's got to give here. So that's when I had the chronic pain, the chronic migraines, every other day. I had the fatigue, and those were sort of my initial symptoms. And over a period of 6 months, my symptoms primarily became anxiety, sensitivity. I was predicting what was going to happen for the rest of the day based on my environment, or based on a smell, or based on a food, because my diet had become so limited. So I was at the point where I was like, okay, is this food going to, put me out for the rest of the day, or cause me to get extremely bloated, or what's going to happen to me? So at that point, I think that chronic, where that acute sort of Lyme became chronic, I had that real shift of, okay, anxiety, stress, that kind of long-term brain fog, fatigue.
Yeah, you mentioned there are 3 different aspects of your story that are very powerful. Number 1, the state of anxiety, or your sympathetic versus parasympathetic system. When you are in that state of anxiety all the time, you're right, our bodies cannot cope with illnesses, with bacteria, with viruses, with recovering or repairing any damage that the body might have. So you're constantly at that state of high alert, and your body's constantly like in a state of anxiety, where you can't escape that moment, and everything bothers you. Like you said, you will eat a meal, and then you will be constantly thinking, is that going to affect me for the rest of the day? Am I going to be nauseous? Am I going to be feeling sick for this? So what kind of strategies do you use to cope, or what can we use to cope to change that sympathetic reaction towards a more parasympathetic reaction?
Yeah. It starts with awareness. Are you or are you not in that state? So I think you're right. Is your, brain saying this food is dangerous, this chemical is dangerous, this activity is dangerous? So when we can cognitively think about, okay, walking around the block is this something that's going to kill me? Is this something that's dangerous? Well, my body is responding in inflammation. So that's a problem, right? That is something that we can be aware of. Okay, maybe my brain is responding like this activity is dangerous. And so it's practicing that awareness of, okay, I think this is fight or flight. You know, same with food, same with chemicals, same with that anxiety that we experience. Are our symptoms chronic? And we've been to the doctor and they can't pinpoint a reason why this is going on. And so you can start to think about this. Okay, it's not all in your head here. It's this cycle that's on repeat of being sympathetic dominant, of the brain communicating to the body that danger is present and you need to respond. And the body's trying to do its best, right? It responds in inflammation, it responds in hives or a sensitivity because it thinks this food is dangerous. So the awareness is the best first step. Mm-hmm. And in the Vital Side program, in the membership that I offer, I teach a structured approach on how to rewire out of that fight or flight response to primarily access that growth and repair response and become more dominant in that response. But there are simple things that we can use today to do that. So it starts with awareness, and then after the awareness, you shift. You learn to shift from these responses. So the first thing that you can do today is really talk to yourself and understand, like, wait a second, this is my limbic system. How can I shift out of this? How can I create a new reality right now and communicate to my brain and body that this isn't a danger? And you can talk to it. You can personify that stress response like it's an entity and it's there, and that's sort of, you know, a cognitive behavioral therapy approach of hey, what happens if you calm down now? What happens if you no longer communicate this message of stress? And then we can also do what I call state changers throughout the day. So ways to break that cyclical pattern of stress and communicate a new reality. So a couple just kind of basic things that you can do. I love blowing out my lips. So just, and I can go on for a while. People are like, how do you do that? I'm like, oh, I do it a lot. But blowing out your lips actually stimulates those facial muscles around your lips, which then if you do it for 10 seconds or longer can stimulate that vagus nerve, that kind of brain gut connection that we have that innervates so many different organs. But when we stimulate that vagus nerve, even in a little way, we send a message to the brain to relax and access that growth and repair response. So next time, if you're, you practice that awareness and you notice that fight or flight response is present, blowing out your lips, for longer than 10 seconds. It could be a quick exercise. And there's so many like that. And I talk about on my Instagram and stuff like that, about those quick tools that you can use, because there's so many we can do to just break the state again and again and again and again.
Yes, and this, I didn't know about the blowing your lips like that. As I never knew that, but I do. What I do is humming exercise.
Yes.
So that also activates the vagus nerves to make sure that that you kind of like snap out of the anxiety cycle. So it's I want to try your method. I'm gonna
yeah, it gets easier to do. Humming is a great one too. If you hum happy birthday twice, I typically tell people that's a good one. But blowing out the lips is kind of fun. It's kind of an active one too. And so if you are in the place where you can be a little bit more physically active, blowing out the lips and even just kind of shaking your body out as you do, you become this like and everything kind of starts to vibrate. It's a cool process of actually shaking out your state, kind of like a dog, when a dog like shakes its body after. My dog does this all the time, where like another dog will come up to him and maybe like go at him a little bit. He's huge. He's like 130 pounds and he's just such a baby. He'll actually shake off the emotion. And that's what's actually going on is dogs have that survival response to shake off the emotion and okay, I'm done. We're done. I've let that go. So you can actually shake it out like a dog, blow out your lips. And that's a great state changer to break that cycle. And we can continue to break that cycle again and again and again.
Okay. As a side note, a dog that is 130 pounds is not a dog. That's a pony. You have a mini horse in your house. That's huge.
I actually own a donkey. He is huge. He is huge. I'm actually getting him therapy dog certified this year, so I'm so excited because he loves people. He loves kids, and he'll run up to them and he's just so big, and kids are like, ah, and then he licks their face. It's fun.
Nice. Lindsay, something else that got my attention about your story is when you share about the Epstein-Barr virus. Many people that I've spoken to, their fibromyalgia, their chronic fatigue, their dizziness, often starts with an episode of Epstein-Barr. So many doctors underestimate it. They are like, oh, it's just like it's just the virus that gives you the chicken pox or the virus that can cause shingles in your body, but it's nothing major. Why do you think that doctors often seem not to give it relevance when so many people complain that their chronic symptoms start with the Epstein-Barr infection?
So it's an interesting question, and I won't really know, why. I honestly don't really know. A couple of assumptions I can make, and then I'll offer you sort of a counter way to look at this because it's an interesting other perspective. So I think for so long, mononucleosis, often related to Epstein-Barr, kind of that active infection, has been thought of in a certain way and treated in a certain way, like so many other viruses. And we don't have a modern approach to treat it. And that's sort of the short answer of, well, a lot of practitioners aren't trained in how to exactly treat the virus. And it's not taught in school. It certainly wasn't taught, this kind of old approach to treating that virus was taught in PA school for me, and I imagine in medical school as well. So we don't have a more modern approach to treating viruses, Epstein-Barr being one of them. Another way to look at Epstein-Barr and look at a lot of different viruses that people are diagnosed with, right? Because when we have fibromyalgia, Lyme disease, whatever it is, oftentimes we'll do a whole lot of testing. We'll come back positive for a whole lot of stuff.
Yep.
So whether it's Epstein-Barr or a tick-borne illness or mold, heavy metals, right? A lot of these things come back positive, not just viruses. Something to just think about and take it however you may is that when you are in this nervous system fight or flight, responding in this survival response, something that happens when you are in this response is that the blood-brain barrier, which is a series of blood vessels in the body responsible for weeding out toxins and viruses and things like that, becomes more permeable. So we become more susceptible to things like viruses or environmental toxins, things like that. And so I encourage you, if you are positive for all these things, it's stressful to look at that test result and think, oh my gosh, I have all of these things. But so many people live with a lot of symbiotically with viruses, bacteria, toxins, things like that, and they don't have those physical symptoms. And oftentimes I think, well, when I was bitten by the tick and contracted Lyme, I think, well, if my husband, who was with me, if he was bitten by the same tick, would he have had that same diagnosis, the same symptoms as me? And that's why a lot of these diagnoses have totally different symptoms, like how I responded to Lyme isn't the same as the next person.
Yes.
So I just, I like to offer a different perspective when it comes to that, because I could go get tested right now and be positive, but with a whole lot of viruses that maybe I'm not symptomatic to, maybe my body is weeding out and responding to effectively. I don't know. So it's just a different perspective to think about things.
Fair enough.
I don't like to get super hung up on the detail of the different kind of things that you test positive for. I like to think of, okay, well, why is my body responding like this? Why am I so reactive and inflammatory to these things? And of course, I'm not negating the fact that a lot of people need treatment and detox. They do. But just another perspective to think about
Yeah,
things.
no, fair enough. Very, very nice to put it that way. The other third aspect of your story was being diagnosed with Lyme disease. I don't know how it is in the States, but in Canada, often the test gives false positives and is not a reliable test. So many people take it privately in a lab in Germany. They send their blood work to Germany because I guess it's more accurate. Uh, and then even if it says, yes, you have it, there is not an actual treatment program to help people with Lyme disease. They give you a round of antibiotics to see if it helps you. And if not, they're kind of like, oh, there's nothing much that we can do about it. How was it for you? Like, did the doctors provide any help, or everything that helped you came from you and neuroplasticity?
So when I finally realized what I had was Lyme disease, it was such an aha moment for me. I had been trained in Massachusetts and I'd worked in hospitals in Connecticut. So I had seen Lyme disease before, but when I was bitten by the tick, it was in California. And I thought, my training showed me that, oh, well, Lyme isn't endemic to the redwoods. So I wasn't thinking, my mind wasn't there about Lyme disease. And then over that kind of, I mentioned 6-month period that I started to get those symptoms, I was traveling, I was going to different countries and I was thinking, oh, I just have jet lag. I just have this, I just have that. As a practitioner, you're never focused on yourself, which I think probably was a big part of why I got, I all of these symptoms came at once and I had my perfect storm. But about 6 months in, we were in Connecticut and my symptoms had gotten really, really bad. And my husband found a tick on him while we were mountain biking and I was trying and I was in tears because I was in so much pain trying to mountain bike. And he flicked the tick off of him and he was like, remember when you had a tick on you? And I was like, oh my gosh. I had this aha moment of this explains so much. I went home and I researched and I was like, I can't believe I didn't think about this sooner. The next day I went to a local office to get this standardized test for Lyme disease here in the States. And when that test came back, it was the same kind of process that is in Canada. You need to have 5 bands out of 8 positive, or 6 bands, and I had 5 of the bands positive, but because I didn't have the 6th one, something like that. I can't totally remember the exact details because that was a while ago, and I don't typically recommend that test, but they couldn't make that diagnosis of Lyme. But he said, the doctor at the time, it was kind of an urgent care clinic, and he said, you know what, I know that you have it, so just start the treatment. So I immediately started that antibiotic treatment. And when we moved to Austin, where I am now, I came in with the story to a couple practitioners, and I got a mixed bag of things. And here I am, super sick, also a PA, also having that medical background, seeking care. And I had one practitioner tell me, this is post-viral syndrome, you're a female in your 20s, mid-20s, like you just need to wait it out. right? I got that response, which of course, we all have had a version of that. And then you're like, if you would have known me, right? And we get that frustration. Of course, that was maddening. And then I went to a couple other people. Then I went more of the integrative functional route, saw a doctor here that I work with a lot now who sends me a lot of his patients. And he did the urine test to test my urine and see if that bacteria was present. And that's when that's the test that came back positive for active Borrelia burgdorferi. And I went through the whole treatment with him, which he's wonderful, and continued the antibiotic treatment. And I was on antibiotics for way too long, but also introduced heavy antiparasitics, did some detox remedies, a lot of detox. I had a grant for Lyme disease with Limelight Foundation at the time, so I had a lot of my treatment covered. Very, very thankful and grateful for them. I wasn't working. My husband had to work from home, so he had to change jobs to do that. I had my sisters move next door to me to help take care of me. I was bedridden for months within the process. And a lot of the treatment that I tried helped to an extent. And it got me so far. And you're right, there is not a specific treatment for Lyme disease, just like there isn't a specific treatment for fibromyalgia, even mold. You have these different protocols that exist, but there's not, this is the treatment and this is the end goal. Yes. And I don't know what you think, but I think a lot of that has to do with the way that people respond so differently to things, to different medications. They present with different symptoms. So at the same time that there is no specific treatment, there's also no specific or patient that looks the same. So it's hard to have that one size fits all approach. And I think a lot of practitioners, definitely not all of them, do their best to kind of work with the patient and figure out a way that helps to treat the active bacteria, but also detox. And a lot of practitioners, just like patients, get really frustrated because maybe they're not seeing that progress. And I think that when that stuckness happens and you have that person who's like, I'm so sensitive to any sort of treatment, I really can't try anything. My doctor says that they want to put me on this medication, but I'm so sensitive that I can't introduce anything. Or that person who's like, I have tried so much and some of it works. And then I get to a place where it doesn't work anymore and I'm still symptomatic. And that's where I was a lot of the things were really helpful. And I was doing the lymphatic drainage and the chiropractor and the PT and like all of this stuff and just surviving every day. And to me, it became this shift of when I learned about the brain, I was like, okay, this makes so much sense because my body, I can look at my body and think, well, this is healthy. Like this arm is viable. Like I've got, this body, it's trying to work for me, but there's a missing component. Yep. And so what I found was if the brain is not included in all of this treatment that you're putting the body through, it's almost as if you're never going to catch up to, or access that the benefits, reap the rewards of it, and it's like there's that missing puzzle piece. And so that's how it was for me, and how I tell a lot of people who are like, should I work with you? Is this part of my treatment plan right now? I always say there's 3 parts. There's process or addressing the physical body, making sure you have good practitioners that you know, like, and trust that are on your team, that are helping you and taking things at your own pace, addressing that physical body. The physical body is important. nervous system, addressing the brain, the control center for the body. If you're communicating a message of survival all the time and you're treating the physical body, well, it's kind of going right through you.
Yeah.
And those sustainable changes won't be made. So addressing the nervous system. And then the third, I don't know if you can guess what this is, but the third is the trauma processing and the emotional processing, the trauma, the medical trauma that comes along with having a chronic illness. I think that's just always something that needs to be addressed, whether it's now or 5-10 years from now. But there is a lot of that trauma that comes along with having chronic illness. And just like, I know you talk a lot about, okay, well, people that have tried to go to the practitioner and then they've been shut down, or like me, have been told, well, you'll just get over it in a couple of months. So I think all three of those components are necessary. It's kind of that middle one that's often overlooked, and that's when vital side comes in.
Now, speaking of vital side, so you started to feel better. At what point did it come to your mind to say, okay, you know what? I tried this neuroplasticity thing. It worked for me. Maybe it can help others. At what point in your journey you decided to start helping others?
So that love for helping others had always been there. Like, I was a 4-year-old with like a little tiny blue medical box, and I was like cutting, into, not my Barbie's hair, like cutting into their leg. Like, I wanted to help them. I'm like, my Barbie's, I need to fix. So I've always wanted to help others. And when I was going through my illness, it was one of those things where I remember going to see a therapist. And I was having a horrible day, such bad pain, such bad anxiety. And I remember telling her, this was not a therapist I saw regularly. It was kind of a new therapist. And she had said, oh my gosh, your story is horrible. That's the worst thing I've ever heard. And she was in her 80s. And I remember looking at her and I was like, okay, well, it's definitely not the worst thing that I've ever heard. And your response, like your reaction is really intense for me. I was like, what? Something good is going to come from this. I know it. I know that this is temporary. And I think it was that inkling that I always had, like even on those dark days, there was this like light at the end of the tunnel, but sometimes the light was like this big, but I would still see it. And even in my darkest moments, where suicide crossed my mind and alternatives crossed my mind, I knew that that was there. And I had to work at uncovering and making that light bigger, and that was a process. But so even from those darkest times, I knew something would come of this. And when I started to get better, when I started to use these tools, there's different programs that are offered out there, which are really cool. There was only like maybe 2 at the time, and now there are more, and people are talking about brain retraining and mental exercises and fight or flight, and I love it. And I think in 10 years' time, this is going to be such a mainstay of medical treatment. But when I started to see those changes, I was like, okay, there's something to this. Why aren't people talking about it? Using your brain as a healing modality. It's non-invasive, right? There aren't any side effects. Yep. And it's you as your own resource. And we have these natural innate healing properties. So I went through a couple programs. I did, everything at the time because I had the grant, and I started meeting people who were using these tools, and some of them just kind of needed more personalization in how they used brain retraining. And so I would talk to them about that. And when I started getting better, and after about a year, I was ready to go back to work. And I was talking to a couple practitioners in Austin, and I kind of thought, you know what? I'm a practitioner. I also have this information. I want to put these two together and figure out a way, to create this thing where we can use our brains as treatment. And not a lot of people are doing this. And certainly not a lot of people that were my age. And so I wanted to talk about it. I wanted to have this be something that was a mainstay treatment. So I started coaching kind of just to see what people liked, what people didn't like, how to personalize practices. I became certified in neuro-linguistic programming, which I think helped to create the program. And then I became certified in EFT tapping and thought field therapy, which also helped to solidify just some of the techniques. And I created VitalSide and had the official VitalSide a little bit over 3 years ago. And when I first started, I was going to people's houses and spending 3 hours with them doing these intensive brain retraining sessions. But obviously that wasn't sustainable. So 8 months later, had created this virtual program, the VitalSide program, which is that virtual 5-day course that people can learn the science, learn the tools, and then if they want the additional, coaching sessions, want that more personalization, then we work together one-on-one.
All right, and Lindsay, can people access your program anywhere across the world as long as they have an internet connection? Like, they can all reach you?
Yes, I've got clients in Sri Lanka, in Australia, all over the world. So yes, anyone can go onto the website vital-side.com or check out the Instagram at my VitalSide. There's a lot of good resources there. There's that video that you mentioned if you want a little bit more of the science behind, like, okay, what really is this? What's a mental exercise? That information is there for you. And then you can join the membership. So we've got the 5-day course, the private forum, and then the membership page where you can join in a community that meets once a week in VitalSide Ed. So there's kind of more to it than just the course, but you can have as much or as little access to me as you want as you go throughout the program. I just love that personalization of it, and anyone can message me anytime because brain retraining seems super weird and kind of scary, but it's all about setting yourself up for your natural resilience, your natural healing properties, and then watching the body do the rest.
All right, Lindsay, and what kind of conditions can people have in order for them to benefit from this? I know in your video that you shared with me, you talk about fibromyalgia, chronic fatigue, Lyme disease. But what other conditions can benefit from taking your program?
Yeah, so I have had so many different conditions, those ones that you mentioned, POTS, I've had people with EDS, people with vestibular issues, and then people with chronic anxiety and PTSD. So the condition doesn't, like that diagnosis doesn't matter as much as identifying with being in that 24/7 fight or flight. So even if your most intense symptoms are dizziness, fatigue, and brain fog, you can learn the same techniques as someone with depression and that feeling of hopelessness, because on the most simplistic level, we're doing a autonomic nervous system shift and reset. So you can use those same tools in a little bit of a different way. So how we use the tools will look different from someone who is depressed and anxious and also pregnant and also really busy than someone who has a chronic illness and maybe is bedridden and maybe has trouble looking at the screen for too long, because of EMF sensitivity. So there are different ways we can use the tools, but if you can identify with being in that fight or flight or what's known as limbic system impairment, then that's a great person, to work with and to start using the tools.
All right. And Lindsay, what kind of expectations should people have? Often, when we're in a chronic state of anxiety or an illness, we often want to find the magic pill that we're like, oh, we take this magic pill and it's going to cure me. What kind of expectations should they have once they come and join your program? I believe that a lot of the work that has to be done is by the person themselves in order to retrain their brain. So, what should they expect from taking the program?
So a lot of people come in with really high hopes, right? You may think that that's expectations, but a lot of it is momentum or motivation that they've created themselves because they've tried everything. And they're at this place right now where they're like, I've seen it, I've tried all the things, or I'm doing other treatments, but I am now empowered to do this thing using my brain, using myself as a resource. And sometimes, tapping into a higher power and bringing in their spirituality into it. I see a lot of people do that. And although I mainly teach about the neuroscience, when we get on those one-on-one sessions, people talk about their spirituality, their faiths, they bring that in. And a lot of what we're doing is accessing one of those kind of higher emotions, like those kind of elevated emotions, and tapping into your spirituality can be so beneficial as well. So having that all, bringing in that sort of individualization and personalization to the process, people have that momentum and motivation. And I have expectations of, oh, this is how you do the practice and it works in this, this is the most ideal way to do it. I think I had those expectations for the first 2 years of my practice. And then I realized people will take from it what they need. So sometimes it's those little shifts. They go through the practice, they learn one exercise, and they're like, oh, okay, I like this one and I'll use this one. And this is the thing that's going to work for me. And sometimes I don't even talk to clients and they don't reach out, and that's okay. And I've given up the expectation that everyone needs to talk to me. But those people that I do work with privately who do reach out, every single one of them has seen a change, whether it's symptom relief, whether it's reaching that full recovery and having the capacity to go back to work and go to school or have a family, live their lives the way they want to. Everyone has, and I can't be the person to tell you exactly how things are going to look. That's up to you. That's tapping into your own resources and figuring out what life looks like for you when you calm the fight or flight, because that's my intention. This is a brain rewiring program to get out of that chronic state of fight or flight. And we do that, and we can absolutely do that. But it's up to you and your body to determine the rest and figure out what life looks like. So I don't like I don't like giving false expectations. If you work with me, I'm pretty direct, and everyone is so different in how they respond, but you take out of it what you put into it. And so those people who are putting in that effort, they're connecting with the things that they like to do, maybe including their family in it, having that support system, maybe even their spirituality, all of those things. Those are the people that commitment daily. Those are the people that see those fast changes. And then I hear from them the next year and they're like, oh, I went to, I had a 80-year-old client who went to Hawaii the next year, and she hadn't left her house in 10 years because of chemical sensitivities. And she was like, oh, I went to Hawaii, I ate all the foods, I sat in all the places, I did all the things. I'm like, wow, that's, I'm always amazed and always impressed. And if you see me in my group sessions, I always have tears in my eyes, just learning how much people are capable of. We have barely touched the surface of how much the brain is capable of, but when you attach that, brain power to that person's motivation and momentum that they create to change, I've seen some extraordinary things.
I know. Lindsay, my last three questions. You mentioned that people can find you on your website. Where else can they find you?
Yes, website vital-side.com. A lot of good information there, a great video that can be a good resource. And you can find me on Facebook at My Vital Side and Instagram at My Vital Side. So on my Instagram, I do post a lot of really helpful content information on there. And there's also a link if you want to subscribe to my newsletter. I send a weekly newsletter with tips and tools and science and all the deals that I have. So those are some good places to find me.
Awesome. What does the future hold for Lindsay?
Oh, good question. Every year I have been amazed by what is happening with Vital Side. I have wonderful people reaching out to me like you know, who are like, oh, I want to talk about this, keep this conversation going. I have a couple new programs in the works that are in the short term that I'm working with some other people on. I have a podcast coming out later this year.
Nice.
So I have some fun stuff like that happening, and eventually my goal is to have Vital Side, something that people are talking about worldwide, and giving talks on how the brain changes, and talking to having a community of people with chronic illness who are learning these tools, shifting their symptoms, and having this be this worldwide phenomenon. And that's my goal. That's my intention. I think there are a lot of key players in neuroplasticity that are talking about this and changing the world, changing the perception of chronic illness. And I just hope to be a part of that. I'm all in for that.
Nice. Awesome. And my last question, Lindsay, is, as you know, the channel is called Find Your Chappiness, so Find Your Happiness. How does Lindsay find her chappiness?
How do I find my chappiness? Well, y'all, the brain is changing all the time. So I tell people I'm always making changes to my brain so that I can show up for you. And every day I dance. Every day I dance. And I'll typically do a workout in the morning, and then around 4 o'clock in the afternoon, I'll go to my garage and I will dance it out. And one of my new favorite things is dancing with my eyes closed. If you have a chronic illness and that seems like crazy for you to do right now, I totally understand. I never thought I'd be able to do that, but even closing my eyes and listening to music and chair dancing is great. But now I'm outside fully physically dancing. That's one of the biggest ways I find my chappiness. Nature, camping, walks, loving, supportive people, my big giant dog cuddles. Those are my mainstays. That's my chappiness.
Oh, that's so amazing. And I'm very happy that we got to connect and that you got to share your story and your journey. I do welcome people to reach out to you. And after watching your video, I do believe that you're more than capable to provide them with some tools and resources for them to get better. So I do encourage people to reach out to you. And yes, thank you very much. And if you and your husband and your giant puppy ever want to come visit Canada, welcome to Canada.
Thank you. Yes, I'm so excited. That'll definitely happen in the next couple of years.
Awesome. All right, Lindsay. Well, pleasure talking to you. And yes, find your chappiness, and we'll chat again soon.
All right, sounds good. Bye-bye.
Bye.